Good morning, student. My name is G.P. Pal and I am Professor of Anatomy. Last week we have learned about the introduction to anatomy. I told you about the definition of anatomy. Then I also taught you about the various branches in anatomy, for example, gross anatomy, histology, that is microscopic anatomy, embryology and genetics. I have also told you about how to study these different branches and why it is important to study these branches. Now, today is the first lecture on general anatomy. I also told you last week that what is general anatomy? It is a small book which deals with the concept in the gross anatomy, the basic concept of the gross anatomy which are necessary to learn the real anatomy, which we will start after 10 to 15 days when the actual study of the anatomy will start. Before that, we want you to train that you should learn some of the basic aspect or general aspect of the gross anatomy. Okay, so today is the first lecture in the general anatomy, and today I am going to teach you what is anatomical terminology. There will be two lectures. Today is the first lecture on to the anatomical terminology. Term means word, and throughout the world the medical professionals, they use some special terms or words which is not used by the general public. Okay, and thus these terms or these words, they are only limited to the medical science, which the various doctors throughout the world they use the same thing. It is a kind of the language. For example, when you are learning the computer, then you have to learn its own language or its own words. Okay, and then only you can learn about the computers. Okay, similarly in anatomy, as terms are there which are many hundred terms are there, and most of these terms they have come from the European countries like Greek and Latin, and that's why some of these terms for you will be difficult to learn in the beginning, but please don't be afraid of these terms. By the practice you will gradually learn this term and there will be no problem, that I can assure you. And this term has to be learned because they form, as I said, a language in which the medical people throughout the world talk to each other. Let's go to the next slide, and here I will tell you what is the meaning of anatomical terminology. Medical people throughout the world use common language of special words or special term while referring to the body structure. Since we will be learning the body structure in human anatomy, that's why these terms are used to refer to the various body structure. These terms are the basic foundation of all medical sciences. So please don't be under confusion that these terms are this new word which you are going to learn today will be used only for anatomy, but these terms are used for in the medical sciences. When you become a clinician, you will be using these terms. Okay, these terms, okay, or this language, okay, of terminology, anatomical terminology, it helps to communicate with each other. As I said, it is a language, okay, medical language, without using the unneeded or ambiguous words. So they are the specific word which you will be using, and when you will be using and you will be communicating with the other fellow, okay, the other doctors, nurses or medical staff, they will immediately understand the meaning of those words. Okay, then you will need not to define those words in detail. Okay, thus anatomical terms forms the vocabulary or the language of the medical science. So in other words, what we are going to learn today is the language of medical science. Okay, we will learn today anatomical position. The first of all, we will learn about the anatomical position, and this anatomical position is an important position which will be form your basis of all those terms. Okay, After learning the anatomical position, secondly we will learn the anatomical planes. Okay, your body is divided into various planes. Our various planes passes through the human body. They are imaginary planes. Then lastly we will learn about the terms of relationship. As per the definition of the human anatomy, it is the study of the structure of the human body, and second part of which was the definition was that and it is also to study the interrelationship between these structures of human body. So that second part, the interrelationship of this human structure, will be defined by the various terms or various words which will tell you about the relationship of the organs with each other. Let's come to the next slide. And here, before beginning of this terminology, I will just teach you very quickly the parts of human body which you already know, but then I will tell you which we make mistake as a general general public, what mistakes are made by in defining the parts of the human body. Human body is has a head. This is the head, okay, and head consists of the skull, that is brain box in which the brain is enclosed, okay, and then there is a face, okay. So there is a head and the face, and face has various parts. For example, this is the forehead, these are the eyes, nose, then lips, the cheek and the chin. These are the various parts of the face. Then there is a neck. We all know the head is joining to the remaining trunk with the help of a narrow neck is there, and trunk has three different parts. Here is the thorax part, then this is the abdominal part, and this is the pelvis, and pelvis is a lower part of the trunk which is lying between the roots of the two thighs, okay, which contain our external genitalia as well as the anal opening, okay. Then there is another part is this is called as upper limb, okay. So this is the upper limb, and upper limb consists of many parts. Say for example, this is shoulder, then this is the upper arm or arm only, then this is the elbow, this is the forearm, the wrist joint and the hand, okay. So there are various parts of the upper limb. Similarly, lower limb has also various parts. Hip, okay, which forms the hip joint also, then there is a thigh, there is a knee joint, then there is a leg, and then this is ankle and the foot. That are the various part of the lower limb. What I wanted to tell you at this stage is that there are some terms which are not used by the common people, okay, only the medical people will use it. For example, arm, okay, in a general public may tell the whole upper limb as the arm, but arm is where? In medical terminology, arm is between the shoulder joint and the elbow joint. So the part of the upper limb which lies between the shoulder joint and the elbow joint, it forms the arm. So never confuse arm as a whole upper limb. It is a special part of the upper limb, okay, between shoulder and the elbow joint. Hand, okay, the hand lies, okay, below the wrist joint, okay. So this much part is only the hand, but some people in general public may speak the hand means whole upper limb. That you should differentiate, okay. Then the leg, where is the leg? Okay, the leg is present between the knee joint and that of the ankle joint. So this part between knee and ankle is the leg. So this was very brief. I have just told you what you should take care when you speak about arm, when you talk about hand, when you talk about the leg, which are specific areas in the human body. In the similar way, when you will see the human body from its posterior aspect or anterior aspect, some of the structure which has to be defined here. For example, here what you will see that the hand, if you will see hand, when the person is standing with the palm or the hand facing forward, then it is the palmar surface, that is palm is called as the palmar surface when a person is standing with the arm on the sides of the body, okay, and when palm are facing forward, okay, this is called as palm, don't call it as hand. That surface is the palmar surface of the hand. And when you see the person standing like this in this diagram, that is from the back side when you are seeing, then this surface, the back surface of the hand is called as the dorsum of the hand. Similarly, in the foot, when you below the ankle, whatsoever foot is present, it has two surface, one is facing upward, that is called as the dorsum of foot. So this surface is the dorsum of the foot is here, okay, just a minute. This surface is the dorsum of the foot, but when you will see the under surface of the foot, okay, that is called as sole in the common language, and this is the plantar surface of the foot. So you have to define which surface of the foot you are referring, whether it is the dorsal surface or the plantar surface of the foot. These two terms which you have to learn. Coming to the our first point here of today's lecture is what is anatomical position. Let's learn first what is anatomical position, and then I will explain you what is its significance, why you have to learn the anatomical position as your first lesson in the gross anatomy, okay. Anatomical position is an imaginary position, that should be in your mind. It is only imaginary, you have to think in your mind, okay. People don't stand in this position, right, you have to think. Anatomical position is an imaginary position in which body is considered to be always erect or in standing. Say for example, in this diagram the person is standing in anatomical position, and since I said that people that don't stand in anatomical position, you have to imagine it, okay. A person or your cadaver, that is dead body, or your patient is always standing erect in the standing position, which is called as the anatomical position. Now, what are the component of anatomical position? You have to imagine a human being standing upside, I mean say erect, and the following conditions should be fulfilled, then only he will be said to be standing in anatomical position. So imagine that your patient or your cadaver, though he is lying on to the dissection table, okay, but or your patient is on the examination table, is there lying on exam or sitting, but you have to imagine always as if he is standing. So the first condition in imagining an anatomical position should be, this condition should be there, that is it should be the body is standing upright, absolutely not leaning forward or backward. A person should stand upright, that is very important condition for anatomy. Second important condition for anatomical positions are his eye or her eyes are looking directly forward. That means if you are standing in a room, you should look to the wall onto the of the side, okay, onto the one side, okay, where you are looking. So your eyes should look directly forward, not to the sides or anywhere, okay. Then the third condition is that upper limbs should be hanging by the side. See this in this diagram, both of his upper limb, you know now what is upper limb, they are hanging by the side comfortably, they should be hanging by the side, but they should hang in the side by the side in such a fashion, in such a way that the palm should look forward. That means we have already learned that this surface is called of the hand is called as palmar surface or palm. They should look forward in front, okay, they should look forward. And the fourth last condition should be that both the lower limbs, you know, they should be parallel to each other, they should be parallel to each other, and feet are directed anteriorly. Their feet should be also directed anteriorly, not onto one side or to the other side. Okay, both the feet should be directed anteriorly. Anteriorly means forward. Okay, anteriorly means they should be direct. So these are the 4 different conditions when person will stand in this 4 different conditions, or when you will imagine him, then only it is your anatomical position, right? So the first lesson which you have learned today is what is anatomical position and how to stand in anatomical position. Now we come to the big question, what is importance of anatomical position? As I said, that either you are dissecting when the cadaver or dead body is just lying on to the dissection table, right? Or when you are examining your patient, whether he is sitting or he is also lying on the examination couch, okay? But at the same time, in your imagination, the person or cadaver should be always standing in erect posture. Imagination, okay? Your imagination should be like that. Why? Because as per our definition of anatomy, we have to learn the interrelation of various parts of the body, okay? And this interrelationship of various parts of the body, they keep on changing in different position. When patient is lying, or when patient is sitting, or when he is standing, when dead body is on the table, or there are the various positions in which the relationship of the organs of the body parts, they keep on changing. They keep on changing. So, but you have to learn the relationship in one particular position, so that when you communicate about this position, the person who is reading your notes or who is listening to you, okay, when you will call to some other doctor, then you will define this relationship of the body part, he should not get confused, because in his mind also the person is, he will be also imagining that person is standing upright in anatomical position, okay, and you will be also talking or writing your notes, okay, in thinking that your patient or your cadaver or your dead body is standing in the anatomical position, so that ultimately you are describing the organs or structure in a fixed position and its relation will not change. Otherwise, with the changing position of lying down, sitting, okay, they are going to change, okay, going to change. So whatsoever is written in your books, okay, when you will learn the gross anatomy books, okay, they are also written, the books are also written thinking that the person is in anatomical position, and that's why the relations will be always fixed, okay, relation will always fix, right? Thus relationship of structure has to define in fixed position, and fixed position is which position? It is our anatomical position, that is the fixed position is there, okay. Let's come to the next slide. Anatomical position is accepted worldwide to describe the anatomical relations in cadavers or the patients, okay, in relations in cadavers, or as I have already described, anatomical position should always be imagined even if cadaver or patient is lying down on table with face upward. That means when a patient is on the table or when cadaver is on the table, and if his face is looking towards the roof, that position is called as supine position, okay, supine. And when if the body, cadaver or dead body or patient is on the table, that is when the face is looking downward, that means his back is looking towards the roof but his face is looking towards downwards, that is called as the prone position, it is called as the prone. So you have learn two different terms, what is supine position and what is prone position and what is anatomical position. Thus you have to remember, make a note of it. Anatomical position, even if patient or cadaver is in supine or prone position, you have to imagine whether the patient is in supine or prone. Always imagine the patient in the anatomical position. I hope that anatomical position and why we should learn or describe the body into anatomical position is clear to you. Okay, let's come to the second aspect of this. After learning the anatomical position, we should now learn the anatomical planes. Okay, now these planes, like the anatomical position, is also imaginary. There is nothing like a plane in human body, but these planes are also imaginary, flat surfaces. So these planes are not a line, it is flat surface, okay, which pass through the body. These planes are passing through the body in different position, as I will describe just now. So why you should learn this anatomical planes? Okay, because the importance of this plane is that we used to describe the interrelationship of body structure, okay, in relation to this plane. So that particular organ is lying, okay, on the side of which plane, it is lying in front of the plane or back side of the plane, it is above that plane or below that plane. So these planes becomes the reference point, okay, to describe the positions of the structure of the human body. Now when we come to the different planes, following are the anatomical planes which passes through the body in anatomical position. So planes are also not passing in any position of the body. You have to always imagine the body now in anatomical position, and then you have to imagine the planes which are passing through in the anatomical. So the first plane which we will run will be our median plane, sagittal plane second, coronal plane and transverse. Just note down that we will learn about 4 planes: median plane, sagittal plane, coronal plane and transverse plane. Let's go to the various planes which are shown in this diagram. You can see that these are the plates, okay, flat structures, not a single line, and these are passing in different direction. For example, this is a median plane. See this is a median plane, okay. I will just, this plane is the median plane. Then there is a plane which is just at right angle to it, which is called as the coronal plane, which is passing through the body. And then this third plane is the transverse plane. The sagittal plane is not shown in this diagram, but I will explain to you in other. So now you know that there are 3 planes, and these 3 planes, they pass at different levels, at different positions in body. Let's come to the first plane, and the first plane is the median plane, okay. Now this plane divides the body in 2 equal halves. See this diagram, upper diagram, though this diagram is drawn that the upper portion is cut horizontally, but don't imagine that. This diagram is passing right from the head, okay. That's just to show it that how deep it is going, okay. That's why this is drawn like that, okay. But this is passing right from your head, okay, and will divide downwards. It's a vertical plane. It is a vertical plane which is going downward, and this is dividing the body in 2 equal halves. In 2 equal halves means then this plane, which is a flat plane, has to pass in exactly into the midline of the body, exactly. Otherwise you cannot get the 2 equal parts which are the mirror image of each other. So imagine a person is standing in anatomical position, and you are cutting that person into 2 equal halves through a plane which is passing exactly in the middle of the body, and that's why this plane is called as the median plane. There are some structure, by example of that you will understand what is median plane. For example, your nose is bisected by the median, that means your nose is divided into equal halves by this plane. So is your lips, so is then your penis, it is also divided into two equal halves. So those structures which lies in the midline, they will be divided, okay, will be bisected by this median plane. I hope you have understood the median. The median plane is a single plane because it will divide the body into equal halves, okay. So it is always a single plane passing from the median part, I mean say the middle part of the body, okay, exactly in the middle. We come now to second plane, that is called as sagittal plane. As I said that they are all imaginary, or you have to think over it. Sagittal plane, and there may be many sagittal plane. Median was a single, but there may be many sagittal plane, and these are planes are exactly parallel to median. So they are either on right side or they are on the left side of the median plane, okay. So you can cut so many median planes here, okay. Just if I will put this here, you can see that this may be another sagittal plane on the one side of this may be another sagittal, this may be another sagittal, this may be another sagittal, so many sagittal. But condition is that it should divide the body into unequal halves, okay, not equal, because it is only median plane which divides the body into equal halves. They will divide the body into unequal halves, and they are either present on right side of the median plane or they are present onto the left side of the median plane, and they are also vertical. They are going from above downwards, so they are also the vertical. So there may be many sagittal planes, okay, many sagittal plane. Coming to this, the coronal plane, third plane, which is called as coronal, and this is also the vertical plane, but this plane is at right angle to the median plane. So median plane was going like this. Now the coronal plane is right angle to this, okay. So if I draw this coronal plane, it is always with the dotted line. I am drawing that median plane. So it is at the right angle to that of the median plane. So how though it will divide the body, and there may be many coronal planes, okay. It is not only single plane but many coronal plane, like many sagittal planes are there. How it will divide the body? That means body will be divided into the anterior and posterior. Anterior and posterior means the part which is just will lie the frontal part and the backward part. So the body will be divided in a frontal part and the backward, and there may be many coronal. But most important point by which you will remember what is coronal plane is it is always right angle to that of the median plane, okay. Why these are called as sagittal plane or coronal plane? Because they are just have derived their name from the sagittal and coronal suture which are present in the skull, on the top of the skull, that you will learn later. But you just remember that they are, because there are suture in the skull which is responsible for giving. Coming to the fourth plane, which was a transverse plane. See this transverse plane, it is right angle to median and coronal also, okay, because it is dividing the body transversely, okay. So it will be right angle to coronal as well as that of the median plane. Now these are perpendicular to the long axis of body, okay. Long axis is because erect posture is anatomical position, person is standing in erect, and there may be so many plane which are just at right angle to that or perpendicular to that of the long axis of the body, okay. These planes will divide the body into an upper and lower part. See this plane is passing here, and then there is an upper part and the lower part below this plane. See the line of the plane, and then there may be an upper part and lower part. This may be from any side, right from head to the feet. You can get any of the plane, I am saying divide the body into transverse plane. Now the oblique plane is easy to define that because it has no rules. Any other plane, okay, it is defined as any other plane passing through the body except the above, except all four above. any other plane which will be there, it will be oblique plane. Sometime we use the oblique, but otherwise we use only the first four plane, that is the median plane, the sagittal plane, then the coronal plane and the transverse plane. I hope you have understood the different planes. I think I should stop here, and then in a separate lecture I should come to the terms of relationship.